So I get asked this question a lot. What about treatment? Do I need to get my adductors released? Do I need to get my pelvis adjusted? Now, treatment certainly won't hurt, and in some situations it can be extremely beneficial. But as we've discussed ad nauseum, OP is caused by the way that you move. Those poor, negative movement patterns, those OP mechanics that are overloading and overworking your adductors. The only way to permanently fix your OP is to permanently change those OP mechanics and to move in a way that stabilizes and supports your body. Too many times I see treatment used as a band-aid for a bullet wound. And what I mean by this is when a patient starts to feel some pain in their adductors after a run or after a game, goes to their therapist, gets some treatment, starts to feel better, then just jumps back on the track to do the exact same thing and limp back to their therapist to get on the table and start the process all over again. This simply isn't going to work, and you're basically just lying to yourself. Treatment can really enhance rehabilitation, and it can enhance the recovery process if it's used correctly. Treatment, and especially self-treatment, should be used to increase mobility, to reduce fascial tension and muscular tension, and essentially allow you to perform your rehab exercises to a higher quality and a greater degree. And by doing so, more rehab, better rehab, you're going to change those movement patterns that are causing your OP a lot quicker. In the 10-stage protocol, we dedicate a stage specifically to self-treatment. And in that stage, we go through step by step the important areas and the important techniques that you need to apply to generate the kind of mobility and movement that you need to perform your rehab to the best degree. Now, I know there's a lot of self-treatment videos out there on YouTube, and a lot of people mention where you should be treating and trigger points and a lot of jargon out there. But I want to really implore to you that we apply a very specific type of treatment called Neurofascial Massage, and that we'll show you how to do this through the self-treatment stage, and that it's very different to a lot of the other types of treatment strategies out there, and it's designed specifically to deal with chronic conditions like OP. Now, when you can perform self-treatment really, really well, it really gives you a buffer, or what I like to describe as a safety blanket for your rehab. And what I mean by that is, if you say go and you go a little too hard on your rehab, and you do a few too many squats or a few too many deadlifts, and you start to pull up sore in an area that you shouldn't, self-treatment is a great tool to calm that area down so that you can get back to performing your rehab. Any time that you lose is time wasted from fixing your OP. And self-treatment can be this great tool to say, okay, cool, I pushed too hard, let me take a day, let me treat myself, let me recover a little bit, let me ease some of this pain. Next day, wake up feeling really good because of it, you can jump straight back in. And from this perspective of improving mobility, improving the technique, and improving the quality of your rehab, and being able to protect yourself if you do push a little too hard and treat yourself, self-treatment can be such an important tool in the recovery process. It just isn't the magic bullet that you're hoping it would be.